Hello everyone, this is Dr. Mo with Wink Orthodontics, where we provide high-value smiles. We're located in the DFW area, and this person presented to us with their parents, and they had the concern of, hey, we don't like how the top front teeth are. They are pushed too far back, and we are concerned. The problem with a case like this is the back teeth are fitting well together super nicely. The top and bottom front teeth are not fitting together well. So what do we do in such a case? Let's look at the top teeth first. You can see the alignment is not too bad. It's not perfect. All the adult teeth are there. So this person is a little bit older for us to make any kind of changes in jaw position without performing surgery. Having said that, that's exactly what the parent wanted us to do. So we went ahead and tried it. What we did is we recommended a face mask. So this is a face mask, and how it works is it pulls the top jaw forward. But first we have to use an expander, and what the expander does is it separates the top jaw into a right and left side, and then we use this head device where the patient wears elastics from the hooks to the face mask. They wear these outside of school, but they wear it all the time outside of school. Here you can see with the expander, the top jaw already has a suture in the middle, separating it. All we do with the expander is widen that gap, and that helps the top jaw move forward when we apply forces with the rubber bands. What I do with my patients is I start them on one elastic, and then we switch to two different elastics on each side. And that really helps pull the jaw forward. And that's exactly what we did with this person. It really worked so well. It changed their profile. I'll show you some profile photos, and I'll show you what it looks like after they were done wearing the face mask. So this right here is the same person after wearing their face mask really well for 9 months. They did it all the time, 16 hours a day, all the time outside of school. They did really well. Look at how much of a difference we got from here to there. Big difference. The molar moved half a tooth forward. The bite is imperfect now in the back, but at least in the front, it is much better. Look at how much space there is between the top and bottom teeth in the front, and same thing here. Obviously, we're not done. We need to fix the bite in the back. It is going to be a little bit of a challenge, and that's something that we'll have to work on. We'll have to do a lot of filing between the bottom teeth to be able to do this. The patient and parent wanted to do Invisalign actually. So we're going to have to do all of this now with Invisalign. Luckily, it is very possible because there's not too much crowding. You can also see how much wider the jaw is. It was already wide to begin with, but even more now. But you can clearly see how much bigger the palate is before and after, even if we zoom out, right? If I brought a ruler and measured, I'm sure it is bigger. I just haven't gotten a chance to do that yet. We'll have to push this premolar in, and obviously this blue stuff is the glue of where the expander used to be. We're going to clean that out before we put in the aligners next time. So here you can clearly see the change in the person's face before and after. Look at how the profile is now and how it was very flat, right? Dark ring under the nose. Very depressed under the eye. Here it is a lot more full profile. It was a dished in flat face. Now you can see the face has a convexity. Luckily, the compliance of the patient made all the difference. We can set up the best plan possible, but if the patients don't comply with the treatment, it just does not work. So this is it for this case. We'll finish it up with aligners, and once we're done, we'll share it with you. This was Dr. Mo with Wink Orthodontics in the DFW area. If you need any help with your orthodontic needs, please come see us. We'll be able to help you at our Prosper or Colleyville location. Thank you for watching.